Hello and welcome to the pharmaphorum podcast. I'm your host, Jonah Comstock. It's 2024, and that means it's an election year in the United States. But don't worry, we're not going to be talking about Vivek Ramaswamy. No, there is another pharma life sciences connection in this election, and it centers on California's 30th Congressional District, formerly Adam Schiff's district. My guest today is Jirair Ratevosian, one of the candidates for that, I would say, quite contentious race. And we're going to talk a little bit about the lack of healthcare expertise, especially public health expertise in Congress as it stands, and why Jirair wants to make a change to that. So welcome to the show.
Jonah, thanks so much for having me. Happy to be here with you.
So first of all, let's just talk a little bit about you. Because you've had a really interesting background, working with the Biden administration, working on public health throughout the pandemic. Tell me a little bit about your story and tell the folks who are listening sort of how you've ended up here.
Yeah, sure. Well, it's, for me, I've always, I'm a son of Armenian immigrants, as any good Armenian son is. I always had an interest in medicine and, started pre-med early in my educational career. I remember being a pre-med major at UCLA. There was always an interest that I had in something else as well, and that was politics. And so I always tried to, I was, continuing the pre-med track and was destined to go to medical school. I remember even taking the MCAT and doing a post-baccalaureate program, in California. But the more I got interested in doing political work and learning about some public health issues like HIV, and I remember vividly this class I took in college called, I'm trying to remember the name. It was something like infectious disease and politics. I think it was literally called that. And I was like, infectious disease and politics. What do those two things have to do with each other, right? And it was almost like the fusion of two of my interests. And that, not to overstate it, but that course really opened my eyes and changed my whole outlook on issues like HIV, for example, that I've devoted my career on and worked on for the last 20 years. But it made me understand how complex some of these issues are with regards to the impact that a virus can have on issues related to religion, politics, social economic status, cultural issues, and how that ecosystem is so related. And so that led me to a field of public health, where I eventually got a public health degree in Boston at BU, a master's degree, and then more recently got a doctoral degree from Johns Hopkins, where I studied the COVID-19 response in low and middle income countries. So public health eventually became a way to satisfy both my interest in medicine and health, but also the connectivity it has to politics. And so it's where I've been since.
Great. So what was really interesting to me about your pitch that came to me is this notion that even though Congress is lately very interested in pharma, and pharma, I think, has been forced to be pretty interested in what Congress is up to after the IRA and with the current inquiries. And I know this is not just the House, but also the Senate, but that in across both houses, there's really no one who's actually worked in pharma at this point. And I know that's not always been the case. So that's interesting that perspective is missing, and that might sort of explain why some of the recent legislative attempts have clashed so badly with the industry. So I'd love to kind of hear your take there on kind of how we got here and what it means.
Yeah, that's an interesting point. I think my team and I kind of stumbled upon that almost accidentally. We were researching how many physicians and nurses are members of Congress. And then we looked at, I remember saying, well, that's not the full picture. Let's look at how many, members there are with advanced degrees, like PhDs in a health topic, and we didn't find. I think we found only one or two, and then we broadened the scope out and said, well, what about chemistry or biochemistry, anything physics, anything that touches healthcare? Again, the return was zero, and it was really an enlightening moment for my team and I when we realized that Congress controls so much of the of the spending that we spend in this country on healthcare. Healthcare is and the large one of the largest percentage of the budget as well. Yet there's so few members of Congress who actually have a health background or any advanced training in health health related issues, let alone experience in the pharmaceutical life sciences sector, like you said. And we looked it up and we didn't find any. And so it really is one of those issues where representation matters, Jonah, and I talk a lot about that in my campaign, and on a number of levels, by the way. So not just as it relates to one's identity. For me, that's important because I'm Armenian American, I'm LGBTQ American, I'm a son of immigrants. Those identities are an important part of the way I show up, the way I look at issues, the way I approach policy challenges, and those identities sorely need representation in Congress. But also as a healthcare leader now who has a doctoral degree in public health, that kind of representation is also needed in Congress to address and some of the big challenges that you alluded to with regards to the IRA and so much more, right? And I think that is something that we have to really think about in terms of the makeup of the committees in Congress, how we're actually involving and members of Congress with that kind of background, and then ultimately what kinds of coalitions are we building and consultations are we doing to actually create legislation that's going to impact and make a difference in people's lives, because so much is on the line with regards to not only cost but also people's lives.
What do you think about something like the drug cost provisions in the IRA? I mean, what the good and bad there, and sort of how would you approach the very legitimate kind of public and patient concerns about drug prices in a way that's also fair and sort of economically viable for the pharma companies?
Yeah, well, it's top of mind for me and many constituents that I talk to, Jonah. They, including my own family members. My mom's a cancer survivor, and she was very scared and of her healthcare bills, and I believe that healthcare fundamentally is a human right, and that no one should be afraid to access healthcare or be turned away for care or treatment, or not have access to medication because of ability to pay, right? So fundamentally those are my values. Now we have a system in place that is a for-profit healthcare system, and we have companies that are working in the ecosystem, but it's important to understand, and the companies are for profit. But one of the things that I worry we didn't mention this, but I've spent 7 years in pharma. I've worked for Gilead Sciences. I was doing a lot of their work in the corporate social responsibility space, and I'm happy to come back to that and talk about what we did there. But that really was an eye-opening experience for me, because I really learned about the complex ecosystem in which these companies operate. And they operate with other hospitals, they operate with pharmacy benefit managers, they operate with insurance companies, and they have to execute supply chain mechanisms that are extremely complex and have multiple pieces, sometimes in different countries. And we learned how the supply chain can be impacted during a COVID global pandemic, right? When one country closes its borders, et cetera, et cetera. My point is, it's extremely complex, but unfortunately it's the system we've got, right? And so I think what the IRA did was really, I think the Biden administration, which I was a part of, has been really committed to wanting to lower prescription drug costs. President Biden has made this a campaign priority, and the president has delivered. He's done this, by the way, both globally and domestically. For your global audience, remember with the TRIPS flexibilities. The president announced that he was looking into TRIPS flexibilities. This was negotiations around COVID-19 vaccines, and that's a huge deal. It ended up not leading to the vote that the WTO wanted, but the point is that the president was not afraid to direct his team to look at certain things on how to reduce drug pricing. I think with the IRA, as your listeners know, it allows Medicare to negotiate prices for certain drugs, and I think there are 3 rounds of them, if I'm not mistaken. And I think it definitely does address. It is one way to lower the cost of drugs but we also have to look at what are some of the unintended consequences of something like that. And the truth is, um, it will lead to lower revenue for some companies, depending on where those drugs fit in the company's, overall revenue forecast. So it definitely hurts the bottom line of companies. You can argue whether that's good or bad. For me, the concern, Jonah, is really we have to ask ourselves, will it impact, the kinds of investments that companies make and the decisions that companies make about research and discovery. You hear a lot about R&D and percentage of a company's overall spending to R&D, and usually that's really high because of the cost of drug manufacturing, the cost of clinical trials, and the cost of research, et cetera. But I worry that these kinds of policies may impact companies to be more cautious about the risks that they take, and that ultimately will have an impact on innovation. And I think more importantly, however, if I could just add, I think I'm more worried about the impact it's going to have on smaller biotech companies. When you look at biotech, and Los Angeles and California in general is rich with biotech companies, small, medium size, the greatest innovation is actually happening at that level, those small biotech companies. That's where you see these firms taking bigger risks. And I worry that the signal that we're sending to them is one that is not necessarily acknowledging the kind of innovation that comes from them, and it's a risk that their investors may be pulling out, and that can curtail some significant advancements that we typically see from that space. So for me, when I would look at policy, I'd always want to look at the entire ecosystem as it relates to the impact that these laws may have, and figure out what are the other levers that we could pull without ultimately harming the ecosystem of innovation that we need to allow these medicines and the science to flourish.
Let's talk a little bit about PEPFAR, the president's emergency plan for AIDS relief. That's a program that you helped to oversee when you were at the State Department. For folks who don't know about PEPFAR, what it is and why it's important, give me a little bit of a grounding there.
Sure. Yeah, I'd love to talk about this. One of my favorite topics. This was one of the. This is the largest foreign assistance program that the United States government has ever undertaken. Over $100 billion, excuse me, have been invested in the global HIV response. It was started by President George W. Bush, and with support from the Congressional Black Caucus and leadership from members of Congress, that really was driven by a moral consciousness to want to fight the HIV epidemic that was ravaging many countries across Africa. President Bush's leadership allowed for $15 billion to be allocated in 2003 over 5 years, and that eventually turned into $48 billion for PEPFAR's second authorization. And so this is now the largest foreign policy initiative that the United States has undertaken in partnership with African countries mostly. There's some that are in Asia as well, and that's to eradicate the HIV epidemic in sub-Saharan Africa. The program that I had the honor of working with had just celebrated its 20th anniversary last year and announced that it had saved 25 million lives. Think about that. 25 million lives are 25 million people are alive because of U.S. taxpayer support, and that's just incredible. Over 5 million babies were born HIV free, to their, because of PEPFAR's innovations and PEPFAR support, and the innovation that we saw from pharmaceutical companies that created these drugs that allowed people to live healthy lives, right? And so PEPFAR is something that all Americans should be proud of. And unfortunately, it's one of the issues that has currently been hijacked in Congress by extreme Republicans who are holding it hostage to negotiations around broader social issues, which are totally not germane to the issue at hand. And I hope Congress moves quickly in reauthorizing PEPFAR so the life-saving work continues without delay.
Historically, has it had bipartisan support behind it?
Yes, it has since its inception. I mentioned President Bush, but every single president after President Bush, including President Obama, including President Trump, and then President Biden, have put their signature pieces to enhance the PEPFAR program, and Congress has always supported its passage in a bipartisan fashion. PEPFAR is one of those things that brought together one of the most extreme members of Congress, in my opinion, Jesse Helms, and on the other side of it, my former boss, one of the most liberal members of Congress, Congresswoman Barbara Lee. So if you can get Congresswoman Barbara Lee and Jesse Helms to agree on something, that's a remarkable achievement, right? And PEPFAR was one of those things that brought them together. And it has been bipartisan every single year for the last 20 years, and now that's currently at risk. And we need Congress to take action immediately because all those lives are on the line. Your listeners may know that, when we're fighting HIV still requires a daily oral treatment. It's a once a day pill that you take for the most part. And, your viral load is suppressed and you have a healthy, normal life. But that is something that has to be maintained, right, for your life. And so that's why the PEPFAR investments continue to be very, very crucial and sorely needed.
So we're running through our time, but I have a few more things I want to talk about. I want to talk a little bit about pandemic preparedness. I know that COVID-19 is very much still an ongoing issue, but there's also a question of sort of being more prepared for the next pandemic than we were for this one. What are some of the steps that you think it's important for the government to be taking right now around infectious disease, around pandemic preparedness?
Thanks. This was my doctoral thesis, and did a lot of work around how do we learn from the COVID-19 vaccine rollout to be able to, inform and strengthen pandemic responses in the future. Drawing from my experience at PEPFAR and then formerly at Gilead, one of the things that I think it's important for people to understand is on the global front, where we have systems in place for pharmaceutical companies to license their IP, their intellectual property, to either directly to generic manufacturers or to this third party called the Medicines Patent Pool, which is an independent agency that pools IP from different companies, and then it organizes licensing agreements with generic manufacturers all around the world. It's a beautiful mechanism that has proven to be effective over the last 20 years since its inception in making sure that IP is protected for companies that create these innovations for HIV or other diseases now, and it pulls the IP from the companies that license it to the Medicines Patent Pool, and it negotiates contracts with generic manufacturers that operate in different settings, and those generic manufacturers are able to produce at a much lower cost the same API and technological methods, the medicines at a more affordable cost for use in low and middle income settings. Companies like Gilead were the first to license to the MPP, and were the first to voluntarily license their IP to generic manufacturers. This was a hallmark of what ultimately lowered HIV drug prices and made them possible to get all across Africa. And I think this is a model that we should be looking at as it relates to the next pandemic. When COVID emerged, you saw companies license their technologies to the medicines patent pool, they were slow, and we have to acknowledge that these things should have happened even before their COVID treatments and vaccines were approved by the FDA. Because by the time they were, and they're still being licensed now, it was too late for millions of people who didn't have access to an oral treatment or a vaccine. So I think as we're looking at preparing for the next pandemic, rather than talking about uh, ways to manufacture products, which I think are important to do in different continents, and there's been a lot of discussion around creating these regional hubs for manufacturing. We also need to ensure that companies are thinking about having licensing agreements that allow manufacturing to happen for different settings in the world, including low and middle income settings. And so they should be working with manufacturers in Africa. They should be working with manufacturers across Asia because they exist. And if those licensing agreements are put in place early, then when the next pandemic hits and the innovation happens from companies, the manufacturing is happening at the same time, and companies are able to, countries and people are able to benefit from the innovation at the same time. And that's how we're going to beat the next pandemic. I think the other main learning, Jonah, is about financing. We can't be cheap if we're going to try to fight a pandemic. We learned this with COVID, and it was a painful lesson to learn. I think one of the things that the Trump administration deserves credit for is Operation Warp Speed. And they invested billions of dollars, and I'd argue there was not enough transparency in the way the money was invested and some of the contracts that were signed with the companies. But I'll give them credit for the scale and the amount in which they invested. And that allowed for companies to take risks. It allowed, and remember we were talking about small biotech companies. A small biotech company, by the way, before COVID was Moderna. Moderna is no longer a small biotech company, but it's an example of how Moderna had an innovation of an mRNA modality that was supported by CEPI and other organizations. But because the United States invested several billions of dollars, it enabled Moderna to rapidly scale up its technology when it was ultimately shown to be effective. And that's why we have a Moderna vaccine. And now that Moderna vaccine is helping to conceptualize vaccines that can one day be used for HIV or other areas. And so I think we have to look at funding and ensure that we're supporting public health departments, public health systems all across our own country, first and foremost, because healthcare workers have to be trained in infectious disease control, and public health departments have to be funded because they've been chronically underfunded for several years. And then we also have to support the network of laboratories and disease surveillance networks that have been set up all across the world, and help other countries enhance their disease detection and health systems at the same time. We have to reject the notion that we can protect ourselves by our borders, and stay safe. We've learned that lesson so many times over the years, and most recently with COVID. So diseases know no borders, and so we have to work with other countries. We're united. If there's one thing that brought us all together during COVID, and that's the fact that all of us were vulnerable, and all of us had to fight COVID and win together, because ultimately that's what beating a pandemic means. And so those are some of the learnings that I had documented in my own research, but I think we need to make sure that we're focusing on as we're getting ready to fight the next pandemic. I know there are negotiations happening at the World Health Organization about a treaty and all this other stuff with regards to sharing of data, et cetera. Those are really important. I hope that there's a good outcome there that folks are negotiating. But many of the answers we already know, and many of the answers we can already implement starting now. We don't need a treaty to be signed before we take steps to prepare for the next pandemic.
So we're running low on time, but I do want to just talk about your race a little bit because it's definitely very interesting. It's a little outside my usual wheelhouse, but you've got the primary coming up in just over a month. And in a race like this, the primary is pretty much the main ball game. You're facing a wide range of opponents, including Fred Savage's brother and a drag queen. It's kind of a crazy, very California kind of situation. How's it going? What's your strategy? What's your main message to the people as you kind of do this last push?
Yeah, well, I love that you mentioned those two of my many candidates, but you're right. It's a very California, it's a very Los Angeles race. There's an awesome opportunity here because we're all in this race to replace a really impactful and well-known member of Congress, Adam Schiff. This is Adam Schiff's seat. He's well known for the work he did to help protect our democracy and hold President Trump accountable for January 6th and everything else that went down during the dark chapter in American history. And this race, there's no one else that has the kind of not only healthcare leadership and background that I have as a public health doctor, but also the federal experience, John. I've worked in Congress as I noted earlier. I worked for Congresswoman Barbara Lee for 4 years, and I worked at the State Department more recently with the Biden administration and my private sector experience. That set of federal experience, private sector experience, makes me one of the most informed and ready candidates to be able to do the job on day one. I already know how Congress works. I already know exactly what to do if voters, if I have their trust and their vote. And I think that is something that, and healthcare is something that comes up almost every single day, as I mentioned. And so I'm constantly talking about how we can look at the ecosystem of issues that impact healthcare costs and work to lower drug costs, make healthcare more accessible. I talk a lot about health equity and advancing, equitable outcomes for all communities. I talk a lot about restoring trust in public health too. Jonah, this is a big issue. After the over politicization of the COVID response, we saw a dip in the public's trust in the way our institutions, handle health. And so we have to remove politics from agencies like the FDA and CDC so that we could restore the public's trust and not make these and leave science and evidence to drive decision making. And then I also talk a lot about AI. AI is something I know you've covered in your podcast, but it's top of mind here because we're in Los Angeles, the birthplace of the film industry, where you saw a lot writers and actors striking for nearly 6 months for better pay and expressing concerns about AI and the impact it has on their own jobs. But AI also has huge impact on healthcare. And while I'm cautiously optimistic about Congress's ability to regulate AI so that it's safe and responsible, I'm actually really excited about what AI can do to streamline drug discovery, optimize clinical trials, strengthen supply chains. Some of the stuff that we've been talking about earlier about how to lower healthcare costs and lower prescription drug costs. I think AI can really help in that regard too, and maybe be responsible for new discoveries. So these are issues that are exciting, that are alive and well in the campaign trail here in LA, and we have an opportunity to elect a healthcare leader to go and solve some of these big challenges, whether it's the future of IRA or the future of other drug pricing issues that Congress needs to tackle, and ultimately expanding more accessibility to Medicare and health, because health is everything, and that's something that I'm focused on.
Absolutely. Do you think that healthcare and some of the things we've been talking about, especially around public health, are salient issues for your voters right now, for Democratic California voters?
Yes, for sure. Healthcare is. Healthcare comes up a lot. And as I mentioned, the AI angle with healthcare comes up a lot, and prescription drugs comes up a lot too. I think we have to do a better job of communicating what's in the IRA. We're having a very wonky conversation right now, but most people don't know what the Inflation Reduction Act has done to lower the prescription, or to start lowering prescription drug costs. But I think people are still concerned about healthcare costs. They're concerned about visiting doctors because they're concerned about bills, and it's definitely top of mind for sure. So I lean in on healthcare issues because there's connectivity with health and the environment. There's connectivity with health and technology that are on people's minds, like I mentioned AI earlier, and so those issues come up very regularly, and I make a point for folks to understand that Congress needs more healthcare leaders. Congress needs more healthcare leaders who understand the way the private sector works and how to harness uh, the innovation that the private sector creates for good, but then also look at the models that have been utilized to enable access for people here in our country and around the world. And those models exist. We just have to know how to harness them and utilize them and support them.
Well, thank you so much for taking the time out of what I'm sure is a busy schedule for you right now, Jirair. It's been a pleasure talking to you, and good luck.
Oh, the pleasure's been mine, Jonah. I can talk about these issues all the time. Thanks for the spotlight you're bringing and all the good work you do as well.
That concludes this episode of the pharmaphorum podcast. You can find more information about this episode, including a download link and information about other installments in the series at pharmaphorum.com/podcast. The pharmaphorum podcast is also available on iTunes, Spotify, Acast, Stitcher, and Podme, where you can find and subscribe by searching for pharmaphorum. And don't forget to visit our website, where you can sign up for daily news and analysis bulletins, and to follow us on Twitter at pharmaphorum. Thanks for listening.